Welcome back once again to my take. Today we're discussing about black fungus. What exactly is the scientific name for black fungus? Doctors call it as mucormycosis. Black fungus, why it is news? Why it is in the news today? You open TV channels, you find black fungus. You read in the newspapers. Today we discuss, is it a new kind of disease? Is it a new kind of pandemic after COVID-19? Friends, mucormycosis or black fungus is not a new disease. It has been there over centuries. How it comes, what are its symptoms, and what parts of your body are affected, and what kind of treatment is required. How dangerous is this black fungus? Black fungus, we call it as mucormycosis. This is a fungal disease. This disease is caused through fungi. This normally we have been getting it over centuries, but this black fungus or this fungal infection is not harmful to human beings because our immune system is so strong that it will not damage any of your body parts. But why it is in the news these days? Why so many people are affected with black fungus having recovered from COVID-19? I'll tell you some of the reasons behind it. The first reason is steroids. People have indiscriminately taken steroids to get fast cure from COVID-19. As a result, their immune system is compromised. And number two, diabetic patients. These two are very dangerous. So after getting COVID, after recovery from COVID, if someone is diabetic and has taken too many steroids, that means his immune system has come down and he will be prone to black fungus or mucormycosis. So that's the main reason behind it. The serious is this disease. If the patient detects the disease initially and gets the cure, nothing will happen. If it is not treated in the initial stage, then it will have repercussions. It's very fatal. More than 50% of the people may die, or you may lose some of your tissues or organs. So they may remove your eye, you may lose eyesight, or you may lose a jaw, or you may lose sensation in your cheek. Okay, let's say there are 5-6 types of mucormycosis or black fungal, but the most common are two. One is which affects your sinus and which affects your brain, and the second one is which affects your lungs. How does it come, right? Say mucormycosis or black fungus. So normally you must have seen leaves or even on the bread pieces leftovers, and then you have fungus on it. Because of this fungus, the spores come out. And these spores, when we take it, they go through our nose. They are there all over the environment. They are there in the atmosphere. So when we inhale it, normally if you are a healthy human being with strong immunity, nothing is going to happen to you. But if your immunity is compromised, if you're weak, then you will have trouble. The moment it goes through your nose, then you'll have nasal congestion, then you have fluid coming from your nose, and then you start, if it goes inside your lungs, then you'll have problem of breathing. from the nose, this is sinus is affected. Why it is called black fungus? Because the part of the cheek, one side of your cheek gets black, the nose gets black, maybe your eyeball gets black. That's why it's called black fungus. Maybe inside your mouth, the sinus, so I mean you can see the palate, that also turns black. That's why normally it is called black fungus. And now it is neglected through your eye, it may go to your brain, then it is fatal. Or otherwise it may destroy, it may spoil your brain, then the doctors have do surgery and remove your eyeball, or in some cases they remove your cheek, the complete jaw. So that is about it, right? Okay, so this comes through spores through your nose. Then what is the treatment? The treatment is antifungal drugs. That's the only treatment you have. There's no vaccine for this, and this disease does not spread from one person to the other person like COVID. It does not spread from animals to human beings, from humans to animals. I just told you there is no vaccination for it, only anti-drugs you have to use. How to avoid it? How to avoid? So only way is, if you are a normal human being, nothing to worry about it. It's not dangerous for you because you have a strong immunity. So even if these spores come in your body, they are destroyed because of your strong immunity. Only in case of diabetic patients, or only because after COVID most of the patients become weak, they lose their immunity. That's why it enters into their body and make it a colony, then it becomes dangerous. So this is found maybe in all, like so where you have decay stuff, maybe so where you have wet. So this disease mostly comes in summers and fall. You never find this disease in winters or spring. So that's all we have.